Chika Onyesi. Thanks for joining us again. On Health Review, we discuss critical healthcare delivery issues that affect you and I and every other Nigerian. Yes, today on the show we will be discussing health insurance in Nigeria and the role of health management organizations. Stay with us on Twitter at Health Review STV and send your contributions to our Facebook page on Health Review on STV. It's now time to bring you news from the global health scene. There is good news as researchers say the number of children who die from diarrhea worldwide has reduced by a third between 2005 and 2015. The study says better access to clean water and sanitation is key, with fewer weak and malnourished children becoming infected. Researchers say new vaccines have also had a positive impact. However, diarrhea is still the fourth biggest killer of children globally, with almost 500,000 a year dying before their 5th birthday. Sudanese government health investigators say 15 children have died from severe toxicity caused by contaminated measles vaccines in a remote village in South Sudan. Investigations indicate that vaccination team members who were neither qualified nor properly trained did not adhere to immunization safety standards approved by WHO. It was reported that a single syringe was reused multiple times during the campaign, causing the contamination of the syringes and the measles vaccines. WHO vaccine safety experts are now examining the cases of 32 other children who suffered fever, vomiting, and diarrhea from the contamination. Okay, moving on now. It's time for a quick break. Don't go anywhere. There is more to come.
Silverbird Television.
The point is this. It's the executive branch. The president has Shagun Ojomo. On this program, we'll be bringing you news, views, and exclusive interviews.
To bring back people, medical experts are on that.
What is the effort so far?
The synergy that has been developed.
Arrived Abuja from Washington, D.C., where he joined President Barack Obama.
Because of the economic recession was over. Now Senator Saki in an interactive
to capture the moment for in-house in session.
With the powers that be.
Welcome back to Health Review. Our topic for today is a very critical one that concerns the less privileged Nigerians. Everybody has a stake in the topic we are discussing today. So we're going straight to the interview segment. Globally, health insurance has become an effective tool for achieving affordable and qualitative health care for many, as it does not allow for any out-of-pocket expenditure. It is a tool many economies have used to achieve universal health coverage. In Nigeria, we have the National Health Insurance Scheme and other privately owned health management organizations. But some health critics say health insurance in Nigeria is currently performing below expectation. Today on the show, we want to discuss health insurance. How can Nigerians fully benefit from health insurance in Nigeria? And we want to also focus on the role of health management organizations in managed care, the ones we call the HMOs in Nigeria. Okay, to do justice to the topic with me today is Dr. Leko Ewela, the Publicity Secretary, Health and Managed Care Association of Nigeria. Doctor, you're welcome to the program. Pleasure to have you here with me today.
Thank you very much.
Okay, health insurance is something that concerns everyone, even that one who we think is the poorest, who sells pure water on the streets. Without health insurance, many Nigerians will be denied health care. But basically, most of us do not even understand what health insurance is. Yes, can you throw a light on that, sir?
Yes, thank you very much for this opportunity to shed light on the importance or the evolution of health insurance in Nigeria.
Okay, sir.
Before the independence, the colonial masters were here, and the concept that was brought was that if you work for government, you can access care in government hospitals.
Yes.
And since 1960 that we became an independent nation, that concept continued to work for the federal, state, and local government civil servants.
Okay.
Government at that three levels never paid medical allowance. to their staff. Now, the International Labour Organization law stipulates that every employer of labor must provide for the medical needs of their employees.
Okay.
And that translates to the payment of a certain percentage of individual staff salaries as medical allowance.
Okay.
But now that really led to medical allowance being paid to staff in the formal sector. Now, by analysis of the population of this country, the population of Nigerians that are working in the public sector, where is the formal sector and the informal sector?
Yeah.
The formal sector comprises of just the public sector, that is the civil servants, the federal, state, and local government level, and the organized private sector is just about 15%.
Okay.
The bulk of Nigerians are in the informal sector.
Okay.
So, since 1960, the government of this country started working assiduously to ensure that healthcare is affordable and is equally accessible. As a matter of fact, it's equally equitable. And several committees were set up to look at how best this could be achieved. And most of these committees traveled to other parts of the world to see what was being done.
Okay.
And long and short of this story was that every report pointed to the fact that the only way Nigerian government could provide affordable, equitable, and accessible healthcare is through health insurance.
Okay.
And for this health insurance to work in this country, it must be operated on a public-private partnership platform.
Okay.
What that means is that the federal government will regulate. The private organizations would now be licensed to drive health insurance for Nigerians, utilizing the services of both public and private hospitals that are meant to be accredited by the NHIS. So the health insurance scheme of Nigeria as we speak today could be said to be standing on a tripod.
Okay.
We have the first leg, the NHIS. The NHIS should and must be seen being the regulator, and as the regulator, his responsibility is solely to set and enforce accreditation standards and set and enforce quality standards and accreditation requirements for the critical stakeholders.
Who are the critical stakeholders? And
the critical stakeholders are the health maintenance organizations. Okay. They are meant to be licensed, like the central bank licensed the banks. Okay. They are meant to be licensed, like the PENCOM licensed the PFAs. Okay. Before they can run.
Operate, yes.
Equally, it is the responsibility of the regulator NHIS to accredit all facilities. As a matter of fact, there are 3 levels of care at levels of assessing care in this country across the globe. We have the primary level of care, secondary and tertiary. The primary is the cornerstone of healthcare services across the world. Yeah. So what would take majority to the hospital is at the primary level. So all facilities must be accredited by the NHIS before they could be seen being service provider on the scheme. Okay. I'd also want to clarify this, and it's good that we are addressing this afternoon. For as early as the early 80s, when these reports were being collected and people were just working towards getting Nigerians, providing affordable health care for Nigerians, a lot of pressure from the government to those that were in government then, and those committee members then, and even from the international community, was that we should commence private health insurance. Okay. Because even if we are waiting for the law or for government to start the public sector scheme, the fact remains that the population of the public sector at the federal level is less than 10% of the entire population. So, and this country is blessed with a lot of with good population. So thereafter, I think a lot of people that are quite patriotic and quite concerned about the wellness and the well-being of Nigerians decided to set up Health Maintenance Administration, and they started driving private health insurance. Okay. As a matter of fact, there was a standard synergy that was established then with the NECA, that is Nigeria Employers Consultative Association, to ensure that all private employees or employers fold onto the program. And the enrollment was so enormous to the extent that, in fact, that really encouraged the government to fast track the signing of the act that established the health insurance scheme that we're talking about today.
Okay, those in the public sector have the NHIS. Those in the private sector.
Let me clarify the issue of NHIS.
Okay.
The establishment of the National Health Insurance Scheme by the Act 35 of 1999 was just to give teeth, legal backing to the health insurance scheme in Nigeria.
Okay.
There has been private health insurance
Privately owned
before
health insurance.
that law was passed in 1999.
Okay.
And then, even since that, even when that law was passed in 1999, the public sector scheme for the federal civil servants and their spouse and 4 children under the age of 18 didn't take off until the year 2005.
Okay, sir. I exactly understand your point. You're trying to establish what the NHIS is an insurance. But now, you have mentioned that those in the public sector have access to the NHIS. Those in the private sector have access to HMOs that are privately owned. What happens to the woman who sells Maggi in the market? What happens to that boy who hawks pure water? Who is eligible to have health insurance in Nigeria?
Yes, there are 2 lacunas affecting the expansion and growth of health insurance as we speak today.
Okay.
And that is why we've been working assiduously with the powers that be to ensure that everybody is given access. And recently, you probably heard about a public hearing that was done. The existing law, as we speak today, does not make health insurance compulsory for everybody. And you know, by our configuration, I want to put it that way, anything that is not enforced or does not come from government, people seem to see how to circumvent it. So, as we speak today, the law for the health insurance scheme in Nigeria is going to be made compulsory.
Okay.
So that makes it mandatory. So either you are a trader, either you are a farmer, either you are a carpenter or a barber, it is compulsory that you must have one form of health insurance or the other. And I tell you the good news. As we speak today, quite a lot of states are beginning to fold onto that particular program. Because what the federal government did in 2005 was meant to have probably show a case of this. Let us lead by example, and the states should follow suit. And unfortunately, that didn't really happen. But with the way things are now, I tell you, a lot of states are coming up with compulsory health insurance for all their residents. Recently, your state just flagged off, and you know.
Shouldn't it be compulsory? States are doing it
compulsory
for states. Is it compulsory for every Nigerian? Is there any way it's been enforced for everyone to access health? Because, you know, one thing that affects healthcare in Nigeria is out-of-pocket payment. People die because there's a case in the hospital and there's no money to pay deposits, and doctors don't attend to. All of us know that truth. Doctors will not attend to you until you have made a down payment. So isn't there something that will, you know, safeguard that woman who cannot make a deposit before? Isn't there a law to mandate?
You see, the important thing for me to clarify at this point is the fact that the health that we're talking about this afternoon is on the concurrent list of in our constitution. And that is why you see that there is a there is a minister of health at the federal level, and there's a commissioner for health at the state level. As a matter of fact, there is a supervisory councillor for health at the local government level. So that goes to say that is not something that can be enforced just at the federal level alone. But because the fact remains that if you look at who are part of the federal government, apart from the civil servants, they are probably just everybody belongs to one state or the other. And that's why the states are now coming up strongly to ensure that, yes, compliance is mandatory. Lagos State just signed their law. I think by October, November, it should be up and running. Or your state, and the federal states are really working towards this. Once this is done, collectively, health insurance will be accessible and will be available, and affordable healthcare rather will be will be available to virtually everybody, because the fact remains that the income or the economic indices of this country differs from state to state, even from local government to local government. Are you with me?
Yes, sir.
From trade to trade, and that behoves that whichever way we are going to drive health insurance, which is what is the concern of the health maintenance organization, because the responsibility of the Health Maintenance Administration. Let me quickly come to that.
We'll get to that, sir.
Okay.
We just want to know. I'm interested in the word affordable.
Yes.
You know, what does it cost to have health insurance? You've mentioned affordable several times, but I'm also worried that it is not everybody who is even in the privately owned organizations that would want to, you know, get their staff to
let me
receive health insurance.
Let me explain it this way,
Okay,
so that
sir.
it can sink into the system or into the mind of everybody.
Okay, sir.
If you intend to provide, let's say, lunch for 2-3 people, and you buy just a small measure of rice, okay, if you look at the amount you're going to buy that small measure of rice for just the two of you, if you now look at how many of that you can find in a bag of rice, you realize that maybe the cost of the bag may translate to about 30-something thousand if you are going to measure. So the concept of health insurance is majorly a concept of pulling funds from quite a reasonable volume of people together to provide healthcare services for the few that will require or that would need it. Because the fact remains that it is not everybody that will fall sick at the same time. So it's a concept of pulling funds together from both the rich and the poor to cross-subsidize the healthcare needs of the poor when the need arises. So it's not, and that is why it's different from paying out of pockets. Because if you are meant to pay out of pockets, you probably pay, certainly you're going to pay more. But a token contribution from you and every other person being put in a particular pool could now serve as a means of providing services for those that would need it. And it is based, you see, and with the introduction of health insurance, I tell you, this country is getting better. It is the pace that might be slow. Because I tell you, if you look at the managed care that was in operation before the public sector scheme was activated, it was basically running on the tariff of the hospitals. So if you have an hospital, if we have your hospital on our network of hospitals as an HMO, by the time we are marketing our products and we are marketing and we are going to showcase network of hospitals, we must have probably established a contract agreement with your facility. You must have given us your tariff, what you charge. Because the fact remains that everybody that is into business determines what amount, not even matter of gains now. Yes, certainly everybody is in business to make profit, but there's a need for you to determine how much you're going to sell your product. Even the women selling body on the streets. So the healthcare providers too, they have their treatment tariff. So the HMOs collect their treatment tariff, we review it with them, and that is on that basis that we work with the hospitals. And that's why it's called managed care, because whatever we agree with the hospital, by the time the bill is sent to the HMO use that tariff collected to vet those bills, and that is when you are paid. And even for the public sector scheme, for the federal civil servant that was introduced in 2005, that was equally an opportunity to properly define what connotes primary health care, what is secondary and tertiary care. In addition to that, it was equally a platform that was used to denominate services at the secondary and tertiary level for the public sector scheme. And on that platform also, there are two key risk bearers for the public sector scheme in particular. All right?
Who is the risk bearer there?
Yes, for the public sector scheme, which is strictly for federal civil servants now, who are probably about 7.5% of the entire population, there are two risk bearers. The primary health care provider, who is meant to provide services at the primary level, is expected to bear the risk at the primary level. And that is why a certain percentage of the premium that was actuarially determined was agreed by the key stakeholders to be paid in advance. That is a prepaid scheme for the hospital to warehouse, to procure their medication and ensure that services are adequately provided and the word affordable is achieved. Because if you have 3,000 enrollees in your facility and the sum of about 750 is being paid up to you up front, that would translate to about 1.7 thereabout million. the fact remains that you can't utilize the 1.7 million to provide services for the few that will come within the month.
Okay, so we don't have much time on this program. There are issues I want us to look at, especially the role of health management organizations. What exactly are they supposed to do when we have the NHIS? What the role? Can you briefly give us that?
Let me clarify that. You see, the National Health Insurance Scheme, like I said at the beginning,
yes, sir,
is the regulator of the scheme. And as the regulator of the scheme, the responsibility is basically to set and enforce quality standards and accreditation requirements for the critical stakeholders, the HMOs, the healthcare providers, among other functions. The key responsibility of the health maintenance organizations, number one, the HMOs are the fund managers.
Okay.
The fund collected on this scheme is meant to be managed by the HMO.
Okay.
The HMO is meant to be the driver of the health insurance scheme in Nigeria, like the banks are collecting deposits in Nigeria.
Okay.
CBN does not collect deposits. PENCOM does not collect premium from yes, it is the PFAs that does that. The same concept was adopted for the running of health insurance in Nigeria.
Oh, okay.
Yeah. So the HMOs are small. In addition to that, it is the responsibility of the HMO to ensure that quality services is provided at all times to the enrollees.
Okay, that brings me to my next question, sir. Quality services.
Yeah.
We have complaints from individuals when they go to access care. Yeah. Do HMOs ensure quality service? Because sometimes patients complain that the kind of care they get is not what they paid for, or what they paid for is not giving them the kind of care they want. Exactly who is supposed to ensure that the patient is not robbed?
Let me tell you this as we speak this afternoon. In my organization, we have well over 2,000 hospitals that we deal with. Okay? And for each facility, we have contract agreements. As a matter of fact, the template of this contract agreement was developed and given to the HMOs by the NHIS. So we need to sign agreements. In addition to that, we visit these facilities on a regular basis. All right? In addition to that, the individual enrollee on this program is given an ID card, and at the back of each ID card there are 2 numbers or 3 or no, whichever way. Those numbers are the numbers of the HMOs. By law, the individual HMOs are expected to have what we call call center, and they are supposed to be call agents in that call center. Are you with me? Okay. Now, these call agents are meant to be nurses who are medically inclined. So when there are issues, when there are issues, when the enrollees are in the hospital, it is their right to call the HMO, even if they are unduly delayed. To that extent, I tell you.
Okay. So briefly, or finally, even in a scale of 1 to 10, how can you rate the climate of health insurance in Nigeria? Are we where we are supposed to be, or do we still have more to do?
We have quite a lot to do, and I tell you that is why that public hearing that was done a couple of weeks back was organized, because it is a concern of everybody that this country or the health indices of this country must change for better. Okay,
what is the solution? The
solution now, first and foremost, is to make health insurance compulsory, mandatory.
Mandatory.
All right. 2, to ensure that the National Health Insurance Scheme, the regulator, is now changed to National Health Insurance Commission. As a commission, it becomes like PENCOM, it becomes like NICOM, it becomes like Nigerian Communications Commission. Those are regulators. You can't walk into the National Commission to buy SIM card. They don't make calls there, but they regulate the activities of the telecom industry the same way. As soon as that is achieved, I tell you, the platform will be so smooth, and the law will be there to ensure that whatever your income level is, as a matter of fact, there's a program that is equally designed for the vulnerable groups, such that if you don't have a means of livelihood, and if you are below poverty level, there's a certain level of care that
you can also access health care,
and somebody will take care of that. Yes.
Okay. There's still more to talk about health insurance issues in Nigeria. We want to get to a stage where everybody can access health care, whether it be the poor person or the rich person. We don't have much time now, so we'll let Dr. Leko Ewela go. He is the Publicity Secretary, Health and Managed Care Association of Nigeria. And we have been discussing health insurance in Nigeria and the role of HMOs, that is the health management organizations in Nigeria. Okay, before we let you go, let's take you to the healthy living tips. To remain healthy during this rainy season, please go through our healthy living tips, especially to avoid waterborne diseases brought by flood and heavy rains this period. Okay, that's a wrap on the program today. We will be back again next week with another package of health review. From me and the rest of the crew, thanks for watching. Bye.